At this point, as a department, we have instituted an investigation, and the person who has been who's been given the responsibility by the department to investigate has started doing the work. Tomorrow morning, we hope we'll have a preliminary report on what actually happened. We feel that these kind of incidences are incidences that are not necessary. Yes, we appreciate that our hospitals are understaffed, and we really feel we associate ourselves with the kind of pressure that our officials are going under. However, as professionals, as health workers, they take an oath. They take an oath to take care of our patients when they get to us. From where we are sitting, it might look as something that is bordering on negligence, and I think it is just not appreciated, and we can't accept it. You can't accept the fact that in a hospital, a public hospital, someone will come and be in that situation and even die in that situation. Can you imagine the discomfort that poor old man must have been going through? And it is where we are sitting. The only thing we are asking our health workers to do is actually treat our patients with care. A health is a right. They have a right to be treated properly. They have a right to be taken care of. We understand that we are understaffed. We understand that they are overworked, but the oath that they took is saying that they must look after the patient right in front of them at that particular point. The staffing issue is a serious problem that we are faced with as a province of KwaZulu-Natal, and over and above the issue of health being a priority in this province, because it is number one in the priority list of the province. As you know, the manifesto of the African National Congress also spoke to the health services being a priority. However, we will not be able to provide proper health care services if we don't have enough staff. It is the matter that the Premier and myself are engaging on how are we going to actually staff the different hospitals that we have in the province, including the clinics. Of course, the biggest challenge that the province is faced with is the fact that we don't have money. And that is a fact. But understanding that the province doesn't have money, it does mean that we will have to cut in other areas so that we are able to actually put some staff into our institutions, even if it means we put a minimum staff requirement so that we are able to run a proper hospital. That is what we will have to do. So we are engaging with the Premier. The Premier has requested us to provide him with a proposal on how best can we turn the situation around, and that's what we are working on currently.